Hi friends, welcome to the channel of Agatandra. We were discussing about the topic that is the general principles of treatment in case of poisoning. In the last class, we have learned about how we can see how much unconscious a patient is or how much comatose a patient is in by using the Reed's classification of consciousness and Glasgow coma scale. Today, let's look into the remaining topics. Coming into the emergency care, whether it is a poisoning case or in any emergency conditions, we have to take care of four main pathways of our body that we can include it in A, B, C, D. A means airway, B means breathing, C circulation, and D that is any disability that is due to neurological complaint. That is any neurological disability. That is the coming into the first, that is the airway. We have to open up or clean up the airway, that is our oral cavity, nostrils, for the secretions, vomit, or any other foreign body. We have to establish a patent airway either by positioning the patient or by suctioning or insertion of an artificial nasal or oropharyngeal airway or by endotracheal intubation. That is, we have to clean up the airway for any other secretions. If there are any secretions due to the poisonous effects such as in opic compounds, etc., then we have to look that or we have to clear that secretions by the means that is either by positioning the patient, by using the suction, by insertion of an artificial nasal or oropharyngeal airway, and endotracheal intubation. Then the second principle is we have to take care of the breathing of the patient. If the arterial blood gas cannot be maintained in spite of establishing an effective airway, then graduated supplemental oxygen therapy, either by a Venti mask or through endotracheal tube, should be administered. That then coming into the third principle, that is circulation, we have to look whether the patient's circulation is proper. We have to look into the circulation by measuring the pulse and blood pressure and estimate the tissue perfusion. That is, example, by measurement of urinary output, skin size, and arterial blood pH. Then we have to place the patient on continuous ECG monitoring. IV fluid administration may be a life-sustaining line. That is, we have to check the circulation of that patient. Can check by measuring the pulse and blood pressure or by using a tissue perfusion. That is, the fluid enters into the tissues. That we can measure by using urinary output or by using the skin signs or by measuring the arterial blood pH. And we have to regularly monitor the patient in an ECG monitor. Then coming into the last point, that is the depression of central nervous system. That is, an unconscious patient, he should be turned to lie on one side to stop the tongue blocking the throat and to allow fluid to come out of the mouth. That is called as the recovery position. That is, the tongue may be blocking the throat. So, in order to prevent that, we have to position the patient sideways so that it will not block the pathway, or if there is any fluid, it comes out through the mouth. In most of the poisoning cases, whether they are conscious or unconscious, they recover with this supportive care alone. Then coming into definitive care of poisoning cases, that is, we have to identify the toxic agent. The main duty is we have to identify the toxic agent that is taken by the history from the relatives or whoever the persons they are admitting the patient, and through investigations or by looking into the signs and symptoms or through circumstantial evidence, and we have to establish the amount and time of ingestion of the poison. General principles of treatment of poisonings: first is removal of unabsorbed poison, second is use of antidotes, third the elimination of poison, and fourth the treatment of general systems that we can look into the next class. Thank you.